I've been very fortunate to have worked with two honest and dedicated lab technicians for most of my career. The first 23 years was Gabriel Pintos. If nothing else, I hope that this series of posts attests to the fact that I sweat every little detail, and that makes me a difficult man to work with. So one day I got a case back from Gabriel. I opened it up. It was a large case, just like the one I showed, and I just didn't like the porcelain. And I would speak with him 2-3 times a day. So I called him up and I just tore into him. I gave him both barrels. And I said, look, what gives? Like, we're this far into the case. The porcelain doesn't look good. We got to remake it. And I just vented. Now, he would always call me Doctor or Dr. Belzycki. And this time he said, Belzycki, you have to go find yourself another lab. I said, what? He said, Belzycki, I'm getting close to my retirement. I'm trying to reduce the stress level, and you provide me the most amount of stress. You need to go find another lab. I can't take it anymore. I tried to apologize, but he wouldn't have it. He would say, you find somebody else. I'll be with you through the transition, but you got to go find yourself another lab. But you have to promise me, I want to remain your patient forever. There was no going back. I understood and I agreed. And some 8 or 9 years later, about 2013, I did restore his upper arch with an implant-supported case, and that is also posted on Oasis. So we've remained friends, close friends, dental brothers, as he says, for all these years. It took me about a year to find Dennis DeMarchi. I presented myself. I took my computer. I opened it up, showed him all the pictures. These are the restorations I've done with Gabriel. I want it done this way. They're supposed to be designed that way. And I went through the whole thing. And then I said to him, no, I'm warning you. I'm a tough man to work for. I just burned out my first lab technician of 20 years, and you're next in line. So do you want this? Do you want a part of me? And he just sat back and he said, look, all I can promise you is that I will try my best. I'll redo cases any number of times at no cost until you're happy. And I thought, well, that's an honest approach. And I said, good. And then you have the right to call me. If there's ever a problem with an impression, or you don't like the way I've prepared teeth or whatever, just call me. And if you need second or third impressions, you'll get them. And we moved forwards. Shortly after that, about a month or so in, he phoned me and he said, Paul, will you become my dentist? And I said, Dennis, it would be my honor. And he became a patient of the practice. And we worked together for many, many years, just like Gabriel. This is the last case that we worked on this case that he had a hand in. He was right in the middle of chemotherapy for lymphoma, about 1.5 years of chemotherapy, and things weren't going that well. And I called him and I said, Dennis, you have to come meet with this patient. Just come select a shade, but more importantly, I seem to be stuck on the anatomy of the teeth. Having worked on this case for several months, it's easy to lose perspective and deceive yourself that what you have is actually good and appropriate. I said, would you please show up? And he said, on that day, I'm going down to Princess Margaret Hospital. I'll swing by the office. I'll take a look. I said, are you sure? Is it too much of a burden? He said, no. I'd love to do it. I need a diversion. It would be good to get back in the game. Fine. So he came in looking a little bit frail, selected a color, and I said, what do you think of the shape of these teeth? Now, Dennis had a certain body language when he's assessing a smile. He would clasp his hands behind his back. He'd squint, he'd stick his head forwards, he'd look one way, then another, and then he'd walk around the patient from the right side and then the left side. And every time I watched this, I would wonder, what is going through his mind? What criteria, what visual clues is he picking up on to make an artistic assessment of what is correct? He was a master at it. After a few moments, he walks behind the patient, doesn't say a word, puts up his hand, and he does this. I said, okay. And I knew in my mind, I understood. I said, Paul, I got to go. Don't want to be late for my appointment. And he left. So what I ended up doing was correcting the cant on this. I showed this before. But a large part of why I did that was Dennis's input. Shortened up the teeth a little bit. We were able to get rid of this pink. Everything just fell into place by this simple. I'll never forget it. That little change made all the difference in the world to this case. Now, while I was working on the temporaries, it took a long time. She says to me, "Is there something wrong with your friend Dennis?" And I said, "Yes." I said, "He's got lymphoma. He's going through for bone marrow replacement, and he's off to Princess Margaret." And she gasped. And she said, "You know, a close family member of mine went through the same thing 10 years ago, still alive, healthy, cancer-free. Please phone your friend. Tell him to have faith. Tell him not to lose hope, that everything will turn out okay." And I phoned Dennis and I told him the story. This case was inserted, as you can see, March 26, 2020. Dennis passed May 15, 2020. I called the patient. I advised her of that. I got another gasp. Oh my God. Yes. So now this patient and I share a bond. We share the benefit of Dennis's artistry and his expertise in this case, and we share the profound sadness of his passing. These poignant moments that I share with patients, the relationships I have with staff, with lab technicians, particularly the two that I've mentioned, they've added immeasurably to the richness of my practice, of the experiences I have here for the past 4 decades. It's not by slick websites or gimmicky advertisement and promotions that we earn trust. We earn trust by demonstrating honesty, integrity, and a commitment to the patient to put them first. That's how trust is earned. I show the picture with these hands often. It signifies a few things to me. Number one is obviously the craft of the hand. But more importantly, it's the patients coming to you with their health and their well-being. And they're saying, please, take care of me. You know, I have to put my trust in you. So the image of these hands mean a lot. The singular trait that sets man apart from the rest of the animal kingdom is the pride and pleasure derived from exercising and pushing forward his own skills. Mine happen to be manual dexterity, craft of the hand in the service of others. And in that, I would like to thank and honor Dennis's memory. Thank you, Dennis, for lending this old school dentist a hand when you needed it most. Thank you.